If you're watching this, chances are you've been taking care of your own hygiene for decades. You know how to shower, you know how to wash, and you certainly don't think of yourself as unhygienic. But here is a frustrating reality that I see in my clinic every single week. I have patients, women over 60, 70, and 80, who come in with recurrent urinary tract infections, bacterial vaginosis, or uncomfortable rashes. They are confused and often embarrassed because they tell me, "Doctor, I am cleaner now than I have ever been in my life." And that is often exactly the problem. Welcome. I'm Dr. Emma. Too often, the health needs of women over 50 are ignored or misunderstood. Not here. I have dedicated 15 years to researching the unique biological changes of midlife. I'm here to cut through the noise and bring you the practical, science-backed insights you deserve. Welcome to your best years. The body you have at 65 is biologically different from the body you had at 35. Post-menopause, the chemistry of your skin in intimate areas changes strictly due to the drop in estrogen. Habits that were perfectly fine or even beneficial in your 30s can actually invite infection in your 60s. Today, we're going deep. We're going to discuss the 5 hygiene mistakes that are silently causing infections in women over 60 and exactly how to fix them to stay healthy, comfortable, and infection-free. Before we get to the mistakes, we need to understand the why. When you go through menopause, your estrogen levels drop significantly. Estrogen wasn't just for reproduction. It was a guardian of your intimate health. It kept the vaginal walls thick, elastic, and moist. It also helped maintain an acidic pH level, usually between 3.8 and 4.5. That acidity is your natural defense system. It kills bad bacteria. But after menopause, the pH rises, becoming more neutral. This thinning of the tissue and loss of acidity is called genitourinary syndrome of menopause. Because your natural defense shield is thinner, your hygiene habits have to be smarter. Let's look at mistake number 1. Mistake number 1 is overwashing and using the wrong products. I know, we were raised to believe that clean smells like a field of lavender or an ocean breeze. But for women over 60, heavily scented soaps, antibacterial bars, and bubble baths are kryptonite. Here's the science. Your vulvar skin now is thinner and more susceptible to microabrasions. When you use harsh soaps, especially those with a high pH level, you strip away the very thin lipid barrier, oil layer, that remains. If you scrub with soap, you're essentially removing the good bacteria, lactobacilli, that are trying to fight off the E. coli and bad bacteria. Once the good guys are gone, you get infections. The fix: stop scrubbing. Your intimate area is self-cleaning internally. Externally, warm water is often enough. Switch your product. If you must use a cleanser, throw away the bar soap. Look for a pH-balanced, non-soap cleanser specifically designed for sensitive skin. It should say fragrance-free, not just unscented, which can still have masking scents. The rule? If you wouldn't put it in your eye, don't put it on your vulva. This brings us to mistake number 2, improper use of liners and pads. As we age, leakage happens. It's common. Whether it's stress incontinence when you sneeze or urge incontinence, to manage this, many women wear panty liners or pads 24/7, just in case. Here's the danger. The vulva needs to breathe. When you wear a synthetic pad with a plastic backing all day, you're creating a greenhouse effect. Heat plus moisture plus darkness. equals a bacterial breeding ground. This environment encourages yeast overgrowth and bacterial imbalances. Furthermore, if you do leak a tiny amount of urine and don't change the pad immediately, that urine creates ammonia as it breaks down. Ammonia is highly irritating to thin, postmenopausal skin, leading to dermatitis, which breaks the skin barrier and lets bacteria in. The fix: go commando at night. You must give your skin 8 hours of air exposure. Sleep without underwear. Change frequently. If you wear liners, change them every 3 to 4 hours, even if they're not full. Matter. If you don't need a heavy pad, look for reusable 100% cotton liners that allow airflow, rather than disposable ones with plastic backings. Mistake number 3 is happening in your laundry room, using fabric softeners and biological detergents on underwear. You might love fluffy towels, but fabric softeners work by coating the fibers of the fabric with a waxy chemical layer. When that chemical layer sits against your intimate tissues, which are now more absorbent and sensitive, it causes contact dermatitis. Irritated skin itches. You scratch, even in your sleep. You create microscopic tears. Bacteria enters. You get an infection. It's a vicious cycle.
Also, biological detergents, common in the UK or Europe, or those with intense stain-fighting enzymes. These enzymes are designed to eat proteins, stains. Your skin is also made of protein. If the rinse cycle isn't perfect, those enzymes stay in the fabric and eat away at your skin defense. The fix: isolate the undergarments. Wash your underwear separately from your regular clothes if possible, or at least change the chemistry. Ditch the softener. Never use fabric softener on underwear. Double rinse. Use a free and clear detergent, no dyes, no perfumes, and set your washing machine to do an extra rinse. You want 0 chemical residue. Mistake number 4 is a sensitive one, but we have to talk about it. Wiping technique and mobility limitations. Anatomy lesson. The female urethra, where urine comes out, is very short. It is shockingly close to the anus. As we age, our mobility decreases. Maybe we have arthritis in the shoulder or hip pain. Reaching back to wipe effectively becomes physically difficult. If you cannot reach properly, you might be wiping back to front without realizing it, or simply not cleaning the area thoroughly. This drags E. coli bacteria from the bowel directly to the urethra. This is the #1 cause of UTIs in older women. Additionally, using dry, harsh toilet paper on thin skin causes irritation. The fix? The bidet. I cannot recommend this enough. You can buy a simple bidet attachment for your toilet for under $40. It washes you with water, eliminating the need for aggressive wiping and contortion. It is a game changer for hygiene. The peri bottle? If a bidet isn't an option, use a peri bottle, a squeeze bottle with an angled neck to rinse with warm water while sitting on the toilet. Pat, don't rub. After rinsing, pat dry gently. The final mistake, and perhaps the most damaging, is normalizing vaginal dryness and atrophy. Many women think, I'm old, I'm supposed to be dry, I just have to live with it. No, you don't. Severe dryness leads to cracks and fissures in the vaginal wall. These are open doors for bacteria. If you have recurrent UTIs, the root cause is often that your tissue is so thin and dry that it cannot support a healthy microbiome. By ignoring the dryness or just using a little lubricant during intimacy, but nothing else, you are leaving your body defenseless against infection. The fix? Vaginal estrogen.
Talk to your doctor about localized vaginal estrogen. It comes in creams, tablets, or rings. It does not carry the same risks as systemic HRT, hormone replacement therapy, because it stays locally in the tissue. It literally thickens the skin, restores the acid balance, and rebuilds your natural shield. Daily moisturizers. If you cannot take hormones, use a vaginal moisturizer, hyaluronic acid-based, every 2 to 3 days. Not a lubricant for sex, but a moisturizer for daily health, just like you moisturize your face. Now that you know the mistakes, how do you know if you already have an infection that needs attention? In women over 60, UTIs often do not present with a fever or burning. Watch for 1. Sudden confusion or delirium. This is a major sign of UTI in the elderly. 2. Falls, weakness caused by infection. 3. Urgency, sudden need to go. 4. A change in odor. If you notice these, do not try to treat it with cranberry juice alone. See your physician. Ladies, getting older is a privilege, but it requires us to adapt. You wouldn't wear the same size shoes you wore as a toddler, so don't use the same hygiene routine you used as a teenager. Let's recap your action plan. 1. Throw out the scented soaps. Warm water or specific pH balance cleansers only. 2. Let it breathe. Sleep without underwear. 3. Rethink your laundry. No fabric softeners on panties. 4. Invest in a bidet. Save your shoulders and improve your hygiene. 5. Treat the dryness. Ask your doctor about vaginal estrogen or moisturizers. If you found this helpful, please share this video. It's an awkward topic, and many of your friends are suffering in silence because they are too embarrassed to ask. Let's break that stigma. Stay healthy, stay informed, and I'll see you in the next video.